Nearly 1/3 of all Americans experience a sleep disorder at some point in their lives, but not everyone seeks help. Doctors stress that the key to effectively treating sleep disorders is getting a proper diagnosis. Sleep experts recommend that adults get between 7 and 9 hours of sleep each night. However, statistics show that most Americans average less than 7. A prolonged lack of sleep increases the risk of developing lifelong health problems or being involved in serious accidents.
When it really culminated, I was driving and I stopped at a stop sign on a rural road, and a quarter of a mile later I sheared off a mailbox, woke up in the ditch with a shattered windshield, and didn't even know it happened.
Because stress and fatigue are such a normal part of modern life, many people don't realize that being unable to sleep at night or always feeling tired during the day could be caused by a sleep disorder. The first step in determining whether you have a sleep disorder is to talk to your doctor. He or she will conduct an extensive evaluation of your sleep patterns.
We'll go over everything that could be potentially impacting their sleep or their daytime functioning. So things that involve lifestyle, substances, their past medical history, medications they might be on, family history of sleep problems.
Your doctor might also refer you to a sleep lab for a test called a polysomnogram.
Get you to your room. We're just headed to the left right here, okay?
A polysomnogram usually begins in the evening. A patient spends the night in a room set up much like a hotel. Sensors are placed on the scalp, face, chest, and limbs. These sensors record brain activity, breathing patterns, heart rhythm, and eye and body movement during sleep. Abnormalities in these areas can indicate a sleep disorder.
We're looking to see how many awakenings they've had. But very importantly, we also are looking at, are there any problems with the heartbeats? We're looking for any kind of abnormal brainwave activity.
Good heart rate.
Once your doctor suspects you might be suffering from a sleep disorder, the next step is to determine which type you have. The most common by far is insomnia. In fact, more than 80% of people with a sleep disorder suffer from insomnia. This condition prevents a person from falling asleep or staying asleep and can lead to fatigue, irritability, and poor memory. While insomnia is often caused by stress or poor sleep habits, it may also be linked to other medical conditions.
If you have diabetes, you're more likely to have insomnia. If you have heart disease, you're more likely to have insomnia.
Sleep apnea is the second most common sleep disorder. This condition is caused when a person's airway becomes restricted, often due to excess fat in the neck and throat. Breathing becomes shallow, or may even stop for brief periods. Symptoms of sleep apnea include snoring, sudden awakening, and shortness of breath.
My husband got very little sleep because he said I was kicking all night, I was stopping breathing, I was snoring.
Sleep apnea can occur at any age, even in infants, but the risk increases for people who are overweight or have high blood pressure. Restless leg syndrome is a sleep disorder that progresses with age and typically becomes more severe after the age of 50. Symptoms are often described as tingling or pain in the legs. This can lead to an irresistible urge to move the legs, making it difficult to sleep.
It gets worse in the evening, and in the morning and during the day, it's much less bothersome.
Narcolepsy is different from other sleep disorders because it causes sudden and unexpected sleep. You could be sitting in class or eating a meal and fall asleep without warning, usually for a period lasting from a few seconds to a few minutes.
Narcolepsy comes on in a relatively predictable age range, typically in the second decade of life. So when somebody's in, let's say, high school or college, that might be the most common age of onset.
Another common type of sleep disorder is parasomnias, which include nightmares, night terrors, and sleepwalking. Sleepwalking refers to a number of disturbances that can occur while asleep. A person might sit up suddenly in bed or talk nonsensically. Actual somnambulism, or walking while asleep, can occur at any age, but it happens most often in children. Nightmares are also more common in children.
People who have nightmares often have recurring nightmares of the same theme, and sometimes that's related to something stressful that happened to them in the past.
Night terrors are a disturbing kind of parasomnia. Symptoms include screaming or crying, and though people appear to be awake, they are usually unable to communicate. While parasomnias are believed to be a normal part of childhood development, frequent episodes may require treatment.
For all of these parasomnias, it's very important to protect sleep. If you're sleep deprived, you're more likely to get the night terrors, you're more likely to have sleepwalking episodes.
No matter what type of sleep disorder a person might have, it's important to seek help. Experts stress that getting adequate sleep, just like eating right and exercising, is essential for maintaining good health.
I recommend patients to talk to their doctors about sleep if they're not getting either sufficient sleep or quality sleep. And I also encourage doctors, very importantly, to ask their patients about sleep. I think sleep should be a new vital sign.
Living with a sleep disorder doesn't mean you have to spend the day yawning or lie in bed at night feeling restless. With the proper diagnosis and the right treatment, you should be able to rest easy.